Welcome to State of Mind, Being Human and Living Well, broadcasting on KSQD Santa Cruz 90.7 FM and live streaming at ksqd.org. I'm your host, Deborah Sloss, licensed marriage and family therapist. September marks World Alzheimer's Awareness Month, so today we're going to be discussing the mental health effects of Alzheimer's disease and related dementias on both patients and their care partners. Joining me today for this discussion are former care partner Anne Friscia and psychologist, support group leader, and educator Dr. Louise Bettner. According to a study in 2018, approximately 5.7 million people are living with dementia in the United States. Alzheimer's disease accounts for approximately 60 to 70% of these cases, followed by vascular dementias. And these numbers are expected to rise as our life expectancy increases. The number of adults living with dementia in the United States is expected to grow exponentially to about 13.8 million by 2050, with increased life expectancy. However, recent studies also suggest that the risk of developing dementia at a specific age has declined over the past 30 years in some high-income countries, which includes the United States. On average, care partners of people with Alzheimer's and related dementias provide care for a longer duration than caregivers of people with any other type of condition. Well over half of family caregivers of people with Alzheimer's and the related dementias provide care for 4 years or more. The intense demands of this type of caregiving often limits a care partner's ability to take care of themselves, and subsequently, they are at greater risk for anxiety, depression, and poorer quality of health than caregivers of people with any other type of conditions. For these reasons, we believe this would be a topic of interest to many of our listeners now or in the future. This show is being recorded in the middle of the coronavirus pandemic here in California, so my guests and I are all recording from remote locations. So we ask you to forgive any sound quality issues or background noises that you may hear. Let me tell you more about our two very experienced guests who are here to help shed light on this topic. Anne Friscia has been a resident of Santa Cruz since 1981. She grew up in New York State, went to college in Ohio, and then came to Santa Cruz when she graduated. She managed her mother, Dixie's care beginning in 2011 when Dixie moved to Santa Cruz to be closer to Anne and continued to do so for the next 9 years. Anne works full-time as an executive administrator for Encompass Community Services and is a licensed fiduciary in the state of California. Anne's mother, Dixie, passed away this past February, and Anne was eager to share with listeners some of what she learned in her many years as her mom's care partner. You can also see a lovely picture of Anne and her mom, Dixie, on our website at ksqd.org. Also with us today is psychologist Louise Bettner, PhD, who's been in private practice for over 40 years in the Bay Area, Davis, and Santa Cruz, California, where she specializes in geriatric mental health treatment and issues of aging. Dr. Bettner was adjunct faculty at John F. Kennedy University in Pleasant Hill, California for 19 years, where she taught core courses for the Department of Graduate Psychology. She also taught continuing and extended education courses for professionals. Dr. Bettner has served as a clinical supervisor and as a consultant with skilled nursing facilities in the Bay Area. In 2018, Dr. Bettner relocated to Santa Cruz, California. Currently, she facilitates early-stage support groups and conducts training programs for the Alzheimer's Association. Now semi-retired, Dr. Bettner is devoting her time to her professional interests and learning to play jazz on her grand piano. I'm so honored to welcome both of these guests to State of Mind. Welcome, and thank you both for being here today with us.
You're welcome. Glad to be here.
Yeah, thank you very much. Very happy to share.
This is a big topic, and I'm sure there's a lot that we are going to try to cover today. But I want to start with you, Louise, and just ask if you could explain what we're talking about when we refer to the word, all the dementias or Alzheimer's disease. Like, what conditions specifically are included in that description, and what are the common features of these conditions?
Okay, dementia is an umbrella term for disorders which are basically brain disorders that tend to decline over time. The most common dementias are Alzheimer's disease, vascular dementia, which is related to many strokes in the brain, Lewy body dementia, which is a different kind of dementia that has proteins called Lewy bodies, which is different from Alzheimer's in some key ways. Parkinson's dementia, which is often comes later in Parkinson's prognosis or the length of the disease. And finally, frontotemporal dementia. Those are the 5 main ones. They are all characterized by problems with memory, executive function, which means you can't problem solve, you have difficulty planning and executing tasks, comprehension, reasoning, and attention span. And some of them, like Parkinson's and Lewy body dementia, also involve disorders of the muscles and nerves. So you have tremors and difficulty with gait and walking. And those are just a few. Many of them in later stages also have symptoms of lack of good reality testing, hallucinations, delusions. Depending on the disorder, you may see little children running around when there aren't any, or believe that someone stole all your money or your glasses when in fact you misplaced them.
So you talked about problems with gait, and I know that falls are a big
Yes.
concern for older adults, so I'm wondering if that's a
Yes.
contributing factor too.
I wouldn't say it's a contributing factor. Falls are associated with lots of conditions. And oftentimes people who have Alzheimer's also have other diseases at the same time or disorders. So becoming frail is one of the issues, and that often leads to falls. So many people will have a history of falls when they become more frail. But I've also seen out people with Alzheimer's disease who have very good balance and are very mobile.
So thank you, Louise. And who's the most at risk?
Well, age is the biggest contributing factor. For myself, I think that there are other factors that contribute, and I think there's more and more evidence. If you don't exercise, if you are extremely overweight, if you smoke, if you really don't eat well, and if you sit all day in a rocking chair, rather than getting out and exercising, you may decline faster. So some of those behaviors and health habits may contribute to not declining as fast.
So what would you say are the signs or behaviors that someone might notice that could indicate that a loved one is experiencing the beginning stages of dementia, and what might they not notice?
Well, initially, you don't notice very much, except occasional problems with forgetting. That's the very mild, the first stage. Then people begin to forget the names of familiar people or familiar places. They will have problems remembering whether they took their medication or whether they ate breakfast. They won't know. They might eat breakfast again. They may become disoriented later in the day. They may search for objects and can't find where they place them. Those are some of the initial ones. Some of the bigger problems have to do with money management or being vulnerable to scams, if people live alone especially, and also problems with medication management and driving. Biggie.
Yeah, great, thank you. And I was wondering, would you be willing to tell us about what condition your mom had, and can you describe the progression of her illness?
My mother had a stroke in 1999, and that set off the progression of illness for her vascular dementia. She had brain damage from that. And it was a major stroke. After her stroke, she couldn't walk or talk, and she went to a rehab hospital for about 6 weeks and was able to walk with the help of a cane. Her personality had changed, and I was told that by a nurse in the hospital that there would be a personality change because of the type of stroke that she had. She was more impulsive and childlike. Her short-term memory was worse at that point. She was able to recover well enough to continue living with her husband, my stepdad, and she was able to do household chores with assistance. But she wasn't as functional ever again after that first stroke. What happened was that my stepdad got Alzheimer's after that. He was 9 years older, and she became his primary caregiver in the early part of Alzheimer's. And that's a very stressful time. My stepdad was a judge and a real estate investor. He was a very successful man and used to being in control. And as his Alzheimer's progressed, he was not able to do the things that he used to do. And my mother had to go through a lot of day-to-day conflicts with him over things like, you need to wear different clothes today, or you've scheduled to perform a wedding today, don't forget to go. And the stress of that increased my mother's blood pressure and led to another series of strokes about 10 years ago. And after those strokes, her dementia really set in. More personality changes and more delusions and memory loss to the point her mother had died. Mother died at 95 in pretty good health until then. So my mother was used to having her in her life and could not remember that she had died. So frequently would ask me for her mother and want to be with her. So she declined over time. Eventually, she got aspiration, had trouble swallowing, which led to pneumonia. Another hospitalization occurred. And after that, she never fully recovered and died about 10 months later.
Oh, again, I'm so sorry about that.
Yeah, thank you.
You know, you also bring up a really interesting point about the issue. I mean, so many people are part of step families, and I'm imagining that adds a particular kind of dynamic to making these kind of decisions. Would you say that that factored in how the decisions were getting made in your combined family?
Yeah, absolutely. Because what had happened is my father had died 27 years ago, and my stepdad's wife had died about only a year before my mother and he married. And so we were all adult children, and his adult children were not able or willing to commit to her care needs and supervise it the way she needed. And when we went to one of the facilities to tour here in Santa Cruz, one of the administrators told me it was not unusual for a second family to balk at the care needs of a dementia patient. It's a very sad situation, a heartbreaking one to watch. And I would have been more willing to see them go to a facility together in New York State so they could stay together because that was her preference and his too. But he was beyond the point of being able to make that decision, and his adult children were not able to convince him. He had been in charge of their family for so many years. When the dynamic changed, it was very, very difficult for everyone.
Yeah, I can really imagine that happening in so many families because the relationships are just not there, or to take on such a big task of caregiving for potentially years to come. You're tuned to listener-supported 90.7 FM KSQD Santa Cruz, K-Squid, many voices, one station. And this is State of Mind, being human and living well. I'm your host, Deborah Sloss, and I'm here talking with former care partner Anne Friscia and psychologist support group leader and educator Dr. Louise Bettner in honor of World Alzheimer's Awareness Month. Today, we're here discussing the mental health effects of Alzheimer's disease and related dementias on both patients and their care partners. Stay with us to learn more, and we'll be right back after this brief message from our underwriter.
KSQD thanks Family Service Agency of the Central Coast for supporting this program. Family Service Agency provides counseling and support for people of all ages facing life crises and challenges. You can reach them at 423-9444 to see if they can help you. Thank you, Family Service Agency of the Central Coast, for supporting KSQD 90.7 FM.
Back to our interview. I want to turn to you, Louise, and just ask, was there anything in Anne's story that you'd like to talk about in order to help our listeners sort of understand issues that come up around dementia illnesses and the roles that care partners find themselves in? It's a broad question.
Oh boy,
yeah.
There's a lot. Well, there's a lot, because that kind of story is one I've heard over and over again, in all kinds of variations. But there are conflicts within families about who takes responsibility when the person who has dementia, or even their care partner, can't manage together as a couple. Because for a time, often people manage as a couple until one of them declines so much that the other one can't handle it. And it sounds like that's what happened here. And it's really sad, because couples can be separated at the end of their lives from the person they love the most. And this is, I think, what happened here. And it happens a lot. Or when one person has to go to a care home or assisted living or a nursing home, and the other one lives at home in the community, and they can't see each other very much. Now with the pandemic, it's even harder, because many of the people that are in facilities are not allowed visitors. So that's the thing.
I was thinking too about how important those visits are for retaining whatever sort of memory and recollection people have. So I'm wondering if under these conditions, you want to talk about the impact of not being able to see their loved ones?
Sure. I also want to add that it is difficult for step families, because step families who come, especially if the couple are in a second or third marriage and the kids are from the first marriage, kids don't know the second spouse that well. And so that makes it difficult then for families to decide who's going to take responsibility. And then you have the added problem that your stepfather didn't want to cooperate with the kinds of recommendations that were made probably by his family and his doctor in terms of what he needed. That's also common. So I just want to kind of underscore that. I am very concerned about the impact of the pandemic on people that are in assisted living or nursing home situations where they're not allowed visitors, because it means that they don't get a certain kind of care, attention, and affection that I think we all need. And there's also no endpoint, which makes it harder. So I am very concerned about the situation. And I think some of the facilities try really hard to use Zoom or other kinds of virtual tools for families to visit. I think that's a wonderful idea. I think we're very lucky that we have Zoom at this point, or Skype.
Mm-hmm. Louise, I want to come back and ask you more about the early stages of the illness, and wondering if someone was concerned about a loved one, how might they talk to them about getting assessed? And are there issues or problems that often come up at these early stages of the illness?
That depends on the person. And it also depends on the stage of the deterioration in the course of the disease. If I say to my mother, for instance, I think you may have some problems with memory, and I'm concerned about that, I wonder if you'd be comfortable talking to your doctor and perhaps my coming with you to talk about what this might mean. It might not be anything, but maybe there's something we can do to help your memory. Some people will respond to that positively and say, sure. You know, some people will say, I don't have a memory problem. So that depends. Or you could say to the person, I'd like just to have you go have a health checkup and see how you're doing. It's always good to know your health status. And you can maybe offer to come along. And in the course of talking to the doctor while you're in the office, you might say, you know, I've also been a little bit concerned that my mom seems to be forgetting things more than she did in the past. And I'm wondering if there's any question about that or anything that you'd like to assess in that regard. Because the doctor then would have the message from me that the person's having memory issues, even if they don't think that they have memory issues. That's usually the first early warning sign is the problems with memory. Sometimes it's difficult though. It depends on, you know, it's helpful if families have established relationships with doctors already so that the person knows the doctor and so the doctor knows the person's health status.
So are you suggesting as your loved ones age, you might want to make time to go with them to one of their medical visits and start to determine?
Absolutely, if they will, yes, if they will do that.
And would you say that doctors are familiar with when people bring that up, what that might mean? Like if they subtly bring up, I'm concerned about memory, are doctors then inclined to take that cue?
They should be. The dementia diagnosis is typically made by a physician. Whether they all do may depend on how they know the patient and how they consider the questions with the problems with memory or perhaps impulse control, you know, or little changes in cognition. So some of that depends on how well educated the doctor is about dementia. And you know, how seriously and how early they really look for those symptoms. I think in general, the doctors are pretty good the ones that I know of, because everybody knows this is a big problem.
And did you have any experience that you'd like to share about interfacing with your mom's doctors and maybe any experiences that might help our listeners?
Well, I was fortunate that my mom's doctors were willing for me to go into visits with her and talk to me openly. I know that out here at PAMP, I signed, you know, special paperwork, and she signed it too in the early years to allow that access. But that's a really important point. Not all doctors will allow that for a child. Probably more likely with a spouse is what I think. But that's very important before you have a real decline to make sure you have access to the doctor, because without that, it causes real problems as you're trying to navigate the early stage of this disease.
Those access usually give you access to the doctor and medical records, I understand, and that would also be really important so that you can manage their care. Is that correct?
It was for me, certainly, a list of medications, diagnoses, scheduling appointments, and follow-ups. It was all really critical in being a care partner, having access to that information, and not everybody does.
Okay. What, Louise, what do you think people should know about the range and severity of dementia symptoms?
I actually want to back up and dovetail with what Anne said about access to the doctor and access to care. Having your documentation in order is really important for all of us. And we all need to designate who's going to be our decision maker if we can't. And we also need to designate who can come to visits with the doctor if possible. So there are agreements about this ahead of time. And as you said, Anne, it made a huge difference because you had all of that in place. And if you don't, it can be problematic. So I just want to underscore that we need to think about that very early on. I would suggest as soon as people get the diagnosis, if not before, that we all take responsibility for our advanced healthcare directives and all of our other paperwork that we need to do around healthcare, estate planning and that kind of thing.
Yeah. So I know that, for instance, certain medical establishments have releases that they have people sign. Are there specific templates or that might guide people about what are the steps that you could refer people to?
One of the things that I will talk about this later, but the Alzheimer's Association does care consultations, and you can call them and consult with one of their staff about a lot of that, and they can guide you. In order to get the paperwork done, I don't know what to call this. It's like documents around healthcare, advanced directives, and that also usually goes along with fiduciary power of attorney and estate planning and that kind of thing. It's kind of a package.
And the Alzheimer's Association, do they have templates that help people?
I believe they would have templates. They would also be able to meet with you and guide you through the process and refer you to elder care lawyers if you need to go to an attorney.
Okay, great. And we'll have, I just want to remind our listeners that we'll have a link to the Alzheimer's Association on our resource page that's posted with the podcast of the show. You're tuned to listener-supported 90.7 FM KSQD K-Squid, and this is State of Mind, Being Human and Living Well. We're also live streaming over the web at ksqd.org, and you can find the podcasts of all our shows on Apple and Google Podcasts and on the KSQD website. I'm your host, Deborah Sloss, and in this show, we're honoring World Alzheimer's Awareness Month by discussing the mental health effects on both patients and their care partners of Alzheimer's disease and related dementias. And with us today to talk about this are two very experienced guests, former care partner Anne Friscia and psychologist, support group leader, and educator Dr. Louise Bettner. I want to remind listeners that all of the resources we talk about in this show can be found at ksqd.org/state-of-mind/. Back to our interview. I'm wondering, Anne, if you want to talk at all about what was the effect for you of your mom's declining health as her dementia progressed, and being in that caregiver role for as long as you were. What were the stresses on you and what did you see happening for yourself?
Well, what I used to tell people was I have two jobs, only one that I can get fired from. And as my mother's health declined, my responsibilities increased. And the correlation meant that my time for myself was much more limited. I was very involved day to day, lots of phone calls, lots of time in her facility. So I had less time for friendships, less time for exercise outside of work and cooking. Things that I used to enjoy doing and take for granted had to be scheduled in, and I had to make a big effort. And what I found was that I lost friends over time because the friendships were neglected to some degree because I was emotionally drained from the experience, and friendships take maintenance. I was able to maintain a small group of friendships, fortunately, during that time, but I was so emotionally drained from the experience, I had less to give. And certainly feelings of isolation set in too. Emotional isolation is big. So it's a hard journey as a caregiver for a person with dementia, there's no doubt.
Over the break, you were also mentioning that you had changed sort of how you were living. Do you want to share anything about that and what you felt you could do?
Well, for example, during my mother's illness, I was not traveling very much. I had changed jobs, fortunately, and I had a job that required less travel. And I was saying no to trips that I normally would take to the East Coast or trips to Europe, going to distant relatives, weddings, things like that. And I had to put that all aside because I was not comfortable leaving my mother as she declined. She could not advocate for herself. So I was her advocate. I was part of the care team in the facility because when I was there, the aides actually trained me to help out with her care. I helped with feeding and changing and also all of her personal entertainment. So I felt very important to her quality of life and wasn't comfortable leaving her.
Yeah, you also you had been mentioning about, what it's like to try to grieve during this time period while the pandemic is going on. Would you be willing to share any of that?
Yeah, what happened was that my mother died before the height of the pandemic. So the positive part of that, if there is one, was that I was able to fly to New York. She was buried near my father. We had a funeral. This was in mid-February. And when I came back, the pandemic began to hit and the isolation began. And what I had thought that I would be doing, visiting friends that I hadn't been able to see, spending more time in the gym, looking forward to travel, I wasn't able to do. So it was a different type of grief process. And it's certainly hard, but in the large scheme of things, I realize how fortunate I am still that I'm healthy and she was able to have a proper funeral and burial before the worst of the pandemic hit New York.
Thank you. Thanks for sharing that. Louise, I want to turn to you, and just as you've heard Anne talking about her experience, I'm wondering what you've seen as the the effects of prolonged caregiving for caregivers, and how that's impacted, how you've seen that impact their mental health over time.
I think it's one of the hardest jobs in the world. I think that it's astounding that something like 80% of the care that's done for people with Alzheimer's and other dementias is done by family members. It's not paid, and it goes on for years. And it speaks to the role of love in families and commitment. And it's a total gift to the person who receives it, because I've seen both. I've seen people cared for by family and when they don't have family. I think the effects are fairly profound because it's such a long process. The person who has the disorder doesn't have any insight. And more you lose the person who might have been able to have some kind of perspective on the situation. So it's kind of like you're dealing with a small child who's not going to grow up and who's much harder to change and much harder to get dressed. And it's sad to lose that person. Sad for them, probably more sad for the family, because more and more they don't know. And it's sad for the community because we don't have a way to really treat it, although there are some drugs. I think that the hardest thing is that it kind of gets harder over time. And sometimes people can put a lot of demands on their caregivers and care partners, calling them multiple times a day. Some of the things you described, Anne, are so typical, you know. And I also want to highlight the fact that you become more isolated over time because so much of your time and attention is devoted to this person who needs care. Even if they're in a facility, but if you're very involved, that you don't have time for friends or for yourself. So self-care is hard to maintain.
Yeah, I've certainly heard people talk about sort of losing touch with all the structures of their own life. If that's their personal interests or their book club, and so their life becomes incredibly restrictive around just providing that care. Yeah, and as you were talking, I was really reflecting on, having raised 3 kids myself, and, the payoff of all that hard work was, some big developmental breakthrough that might happen, or that it does get easier over time. And so I was really getting on a deep level as you were talking how hard it would be to provide that ongoing care while they're just losing ability, as opposed to, some breakthrough happening, or
Yeah, there's no breakthrough.
yeah.
There's no breakthrough.
Yeah.
Now, what I will say, which I think is important, is that even as people lose the ability to know your name or quite recognize who you are, I think the body remembers. And so I think there is memory there of who you are, even if the person doesn't know your name, or even whether you're a daughter or a mother. but your family and you're familiar, or you feel friendly, or whatever you want to call it. And I do believe that that lasts until the very end.
Mhm.
So
Yeah, so maybe our listeners want to reach out and call someone who you know is caring for someone. Just say hello and ask them how they're doing today. It sounds like they could use all the support they can get. And I was wondering if there's anything along your journey that you found yourself wishing that you had known earlier, or something that you thought if you had understood about either the illness or your role as a care partner, it would have been helpful to you.
I wish I had intervened earlier when my stepdad started getting Alzheimer's.
mhm.
If the family had been able at that point to bring in care or to plan for an assisted living they could have gone to together before his disease progressed so far, we might have had options.
For them to stay together, is that what you mean?
For them to stay together, we waited too long. And by the time it was very, very obvious, it was too late and he was unable to make a good decision, and they weren't able to take control of the situation with him. So that was my regret, because I saw it happening and I saw my mother being his caregiver, and it was very stressful for her. And the stress really made it more likely for her to have additional strokes, I think, ultimately.
Mm. Louise, you've led many groups for
Yes.
people with dementia illnesses, also for their care partners. Yes.
Yes.
And so I'm wondering, what do you see as, the biggest needs in those two groups? And what do people, coming to the support groups, what are they getting from that experience?
Well, it's somewhat different for people who have the disease and the
Mhm.
care partners. The way that the Alzheimer's Association has set this up is that the people with the disease meet in separate groups from their care partners, who are often their spouses. For people with the disease, having the emotional support of other people in the same situation is invaluable. And over time, they build connections and relationships with each other that can last and last and last. So what I've been struck by is the bonds that people form with each other. Even if they don't talk about anything terribly, it can be kind of not, I wouldn't call it trivial, but you don't have to talk about real deep stuff. But just to be able to have a group and talk about your day and talk about your week and kind of hear about what people are going through, it means a lot to people with the disease. And the people that can't drive anymore can all commiserate on the fact that they can't drive. For the care partners, having a place where they can talk with other people in the same situation about their struggles and share strategies and share interventions they've used and share feelings is really invaluable. Because I don't know that anyone can really know what it's like to be a care partner or a caregiver until you do it. It's really something. So I think those kind of support groups are invaluable.
And you mentioned that you attended a support group. Would you be interested to share what was of value for you there, and what did you find yourself needing the most that you might have gotten from the group?
I thought the group was invaluable over the whole experience now, looking back. I got support, I got ideas, I got great referrals to resources from them. It was led by a social worker that really knew the county and knew the facilities and the resources that were available. And it was just fantastic, because I really was doing it basically on my own. And without their support, it would have been so much harder. So I'm just eternally grateful to that group and the support that they gave me during the probably 7 years that I was there.
And what happens after your loved one passes? Do people continue to attend the group, or what happens?
I've gone back a couple times. I don't go as often, but I do go and I listen and I offer advice. I'm in a different place now when I go. And when I listen to their stories, I kind of remember what I went through, because it's hard after the loss of someone you love as much as I love my mother. And listening to their stories reminds me of the journey that I was on and my mother's decline. And it wasn't realistic for me to expect her to live indefinitely in that kind of condition. So it's been good to go to the support group and hear their stories and be of support to them. I will say that there's a real difference between the people that come for the first time and the people that have been there for years. And I remember the group leader telling me, we have to be careful because the first time arrivals can be scared off listening to the stories of the people near the end of the journey, because it is so hard and so intense, and it can be frightening.
I'm wondering, Louise, I'm always interested in the role that stigma plays around all different mental health related issues. And I'm wondering, would you say that in terms of people's access to care or acceptance of diagnosis, does stigma play a role around Alzheimer's and other dementias?
I want to respond to that in a moment. I want to add something to what Ann just
we'll come
talked
back.
about.
I'll ask it again.
Yeah, she mentioned not intervening soon enough. So I think that one of the messages we need to get out to the public is to understand that when you get a diagnosis of Alzheimer's disease or vascular dementia or some of the other dementias, there are a number of them, Lewy body, that at some point you need to know, and you need to consider this when you consider placement in a facility, that person will develop, most likely, lack of insight, complete lack of insight, impulsivity, problem behaviors, aggression, and an inability to problem solve and plan in any kind of meaningful way. And that is going to happen, most likely, so that if we know that, we don't wait. We plan early. I see Ann nodding. I think that's a really important message to get out. So where that dovetails with stigma is that it seems that anything that involves your mind, whether it's schizophrenia, bipolar disorder, even post-traumatic stress disorders in some ways, and dementias, they all get lumped together as that you've got a mental health problem, and that's bad. That somehow, the stigma is changing, but there's still a lot of feeling that people don't want to go near it.
So what's the impacts of that, would you say, in terms of people's access to care or treatment? Or
they don't go soon enough. They don't get help soon enough. They deny it. They avoid it. Instead of really going and getting an assessment right away, might put it off for a year or two, because at the beginning it's very mild. But the longer you put it off, for one thing, there are some medications that help delay progression, and they've got a new one that they're going to submit for the FDA approval. That's it. It's trials at this point, clinical trials. So yes, I think it makes people delay and avoid and minimize and blame the person. It's shaming. Stigma is very wrapped up with shame. So, and certainly in the old days, nobody wanted to admit that they had a problem like dementia.
Fortunately, it sounds like that's changing as there's more awareness about it.
Well, I actually think that the Alzheimer's Association is doing a great job out there. They're so visible, and they do walks, and they do all these fundraisers, and they have ads, and everything. They're getting the word out.
Yeah.
That's one of the reasons I like being involved with that organization.
And would you say in your caregiving journey, or your mom's experience, you were affected by stigma in any way?
Yeah, I would say what happened was that her friends and even some of the relatives were apprehensive once they called and realized she couldn't really talk well on the phone anymore. And they were just afraid of it and stayed away and lost contact. It's very hard for people to cope with it. Everyone is scared, and they were disturbed seeing her decline, and they couldn't deal with it very well, so they just withdrew. So it increased the isolation.
You're tuned to listener-supported 90.7 FM KSQD, K-Squid, community radio for the Monterey Bay. And this is State of Mind, being human and living well. We're also live streaming over the web at ksqd.org. I'm your host, Deborah Sloss, and September is World Alzheimer's Awareness Month. So I'm here talking with former care partner Anne Friscia and psychologist, support group leader, and educator Dr. Louise Bettner about the mental health effects of Alzheimer's disease and related dementias on both patients and their care partners. Stay with us to learn more, including information about local resources. We'll be right back after this brief message from our underwriter.
KSQD thanks the Santa Cruz chapter of Alzheimer's Association for supporting State of Mind. Alzheimer's Association provides an array of support for persons with dementia and their care partners. More information is available at alz.org. Thank you, Alzheimer's Association, for supporting Community Radio, KSQD 90.7 FM.
Back to our interview. So unfortunately, we're getting to the end, and I wish we could keep talking because clearly there are many more questions I'd like to ask, and I'm sure our listeners would like to ask, which actually makes me wonder, do either of you want to make yourselves available for listeners to contact you? And if so, how would they get in touch with you?
They can get in touch with me. The email is Louise, and then the 86 Bettner, Bettner, at gmail.com. And my phone number is 530-902-1510. And if you have questions, you may call me and I can help you.
Are there any closing thoughts that you want to be sure to leave our listeners with? Either of you could start.
Okay, I'll go first. I'm Louise. First of all, understand that dementia is a brain disorder. It is an illness. It's not something that's wrong with you. It's not your fault. It's not that you're losing your mind, although there is a way that happens. So get rid of the stigma, and we need to do that. Secondly, to emphasize that given that so much of this care is done by family members, to have great compassionate support for people that are doing this caregiving. I think a lot of the public doesn't have any idea how difficult it is and how long it goes on and how much you can develop compassion fatigue and burnout from it. So to really support those people that you know that are taking care of someone with any dementia.
Thank you. Anne, what about you?
Do the planning, as we've talked about. The financial and legal planning is just critical, and it should be done early. Seek out resources in your community. Realize it's going to be hard and accept that you won't always be perfect. And if you're lucky like I am to have employers that were accommodating during my time, that made a big difference, because it was really important to look at my own long-term plan too for my life and resources and make sure that I could come out the caregiving journey and be able to live my best life going forward.
Our In Your Voice segments give you a chance to share a piece of your story in your own voice. You can comment on a previous show, ask a question for an upcoming show, or share a resource. This is how it works. You just give us a call at 831-824-4324 and leave a 1 to 3 minute message with your name and your comments or questions. Alternatively, you can record a short audio file right on your phone and email that into us at debra.stateofmind@ksqd.org. Some of our upcoming show topics are examining the impact of racism on mental health, discussing accessibility to mental health services for people of color, and Santa Cruz County Mental Health Crisis Services. Your voice may just become part of one of our future shows. Now we hear from Sherry, a listener.
I'm Sherry, wife of Dr. Walter Pepper, my Prince Charming for 29 years. Walter died January 2020 as a result of complications from Alzheimer's disease. My best tips and lessons: enjoy each other, simplify your lives, be determined to find ways to make the things you want to enjoy together doable, like travel. You won't regret it. Be creative, ask for help or accommodations, do whatever to make it happen. Use the Alzheimer's Association website for information. The local Alzheimer's chapter has classes, therapy, workshops. The Couples Mild Diagnosis Therapy weekly group saved our sanity. It was my 12-step program, and Walt didn't feel alone. The only positive changes I could make with this disease were exercise and diet for my husband. A caregiver from Senior Network Services took him to the gym for a workout routine. He coached him on. Then they would have a treat, walk and talk, a 2-hour outing 3 times a week. It was 6 hours a week for me time. The other 4 days we walked. I was determined to feed his brain proteins and healthy foods. As the disease progressed, he lost sense of taste and hunger, except for sugar. He loved going out, but he ate less and less, and conversation was minimal. In advanced stage, I lost the battle. His happiness was more important than his protein intake. When getting dressed was more of a challenge, I numbered clothing with clothespins. Later, I learned to lay out his clothes in a line and helped him dress. Tommy Hilfiger adaptive wear and pajama jeans brands online are pull-on and have magnets, so no belts, zippers, or buttons. The best shoes are leather clogs. Whiteboards are the best tools. At home, I wrote out a daily schedule and important events in simple words, color-coded. At first, he read the daily schedule to me, wrote it down, and carried it in his pocket for reminders. Later on, I had to help him write it. At Memory Care, staff read whiteboards to Walt when he was confused. They also saw our schedules for the day and the week. Choose a residential facility that only deals with memory care patients. Trained staff is usually better equipped to handle brain impairments. Best advice ever. When Walter became a resident of a memory care facility, a friend said, "Now you can just be his wife again, like a Disneyland dad. You get to do all the fun things. Go to the walks along the beach, more hugs and kisses, holding hands and playing cards. You now have a village. Let others do the things you would rather not do. Enjoy what precious time you have together. You are paying for board and care, but it is not a medical facility. Someone in your family who has the time needs to be the advocate to make sure the patient is properly cared for, receive the services you paid for, and meds are properly dispensed. At Memory Care, it is time for hospice as soon as your resident qualifies. The services, equipment, necessary medical care, and 24-hour hotline are invaluable. Palliative care is offered with both Santa Cruz hospice agencies. Be sure you and hospice are in total agreement with the treatment plan you want. End-of-life stage is a totally different mindset. Hospice is the best resource and comfort for the patient and the family at the end stage. This disease is such a complex emotional journey for all. It strips the patient of their dignity and quality of life. But I do believe it is harder for family and loved ones to witness. My last lesson: don't beat yourself up by saying or doing the wrong things. We are all human and not prepared for this chapter of life. Just saying, "I'm sorry and I love you," is the best prescription to calm the situation and then redirect with kindness.
Thank you, Sherry. I'm your host, Deborah Sloss, and I want to say thank you again to my guests today, Ann Friscia and Dr. Louise Bettner, and thanks to you for joining us here on State of Mind, Being Human and Living Well. To hear more conversations about mental health and wellness here on California's Central Coast, Join me on the first Sunday of every month from 6 to 7 p.m. right here on K-Squid 90.7 FM. Special thanks to Jeannie Baldzikowski for audio production and to Jennifer Young, who assists with research and outreach. And thanks to acoustic guitarist Adrian Legg for composing, performing, and donating the use of our theme music. You can find all the podcast episodes of this show on our ksqd.org website by typing State of Mind in the search bar, or subscribe and get them delivered directly to your listening device on either Apple or Google Podcasts. You can also listen to us here on K-Squid through your home smart speaker by saying Play KSQD on TuneIn. This is listener-supported community radio, so that means we want and we need to hear from you. If you like this or any previous State of Mind episodes, please help the shows get found and heard by more listeners by leaving us a rating and a review on Apple Podcasts and Google Podcasts. Or post your comments at the bottom of the page on any one of our State of Mind podcasts at ksqd.org. To hear your voice on one of our shows, call us at 831-824-4324 and leave us a message with your name and your comments or questions. Or record a short audio file on your phone and email that in to us at debra.stateofmind@ksqd.org. This is KSQD Santa Cruz. Just remember, 90.7 FM, K-Squid, your ink spot on the dial. Stay with us.